Hi Farmies, my next video for you is on a medication called Filgrastim, and it is used in the treatment of neutropenia. So it increases the production of neutrophils, it decreases our risk of infection in patients who are neutropenic, usually related to chemotherapy. It stimulates the bone marrow to increase production of neutrophils. And side effects, since we're stimulating bone marrow, they may experience some bone pain, and we may stimulate too much. Just like with any other farm thing, if we do too much of a good thing, it's considered a side effect. So they may end up with high white blood cell counts. Again, with this medication, we're not going to agitate the vial, and we're going to monitor their labs. So I have a couple of pictures for you. Here's our patient who is getting chemotherapy. So patient gets chemotherapy, all kinds of cells. Remember, any cells that are being rapidly growing cells are killed by chemotherapy. So the point is to kill the cancer cells, but at the same time, we kill some of the white blood cells. And if we don't have enough white blood cells, this leads to infections. So we need to do something for these patients. So our response is that we give these patients Filgrastim. So our body has its own granulocyte colony stimulating factor. This is our own body produces this, but in this situation we're not able to produce enough. We want to stimulate this colony of bone marrow to produce more neutrophils. So we're going to give them some extra. Filgrastim is a synthesized version of this colony stimulating factor. So we give Filgrastim, it stimulates the bones to produce more white blood cells. So now we have improved our immune system and we're able to fight those infections. Alright, so colony stimulating factor, Filgrastim, increases white blood cells, specifically neutrophils, and it helps our chemotherapy patients fight infections.